Just had a wisdom tooth removed. This is something I want you to know before you eat, rinse your mouth, or check the area too much. A few little choices on the first days can make the healing process a lot smoother. Hi, I'm Dr. Natalia from Hisonrisa, a dental clinic at Roma Sur, Mexico City. I am going to keep this simple and practical. The gauze, the clot, what to eat, what not to eat, how to clean yourself, and even when to text us. The most important idea is this: to protect the area and protect the blood clot. That blood clot is key for the proper healing of the area. If we lose that clot too early, the area can become more painful and healing can become slower. So if you remember only one thing from this video, be gentle with the area. These instructions are for wisdom tooth extraction aftercare. They are general instructions, so your case may be a little different from others. It depends on how the tooth was positioned, how the extraction went, and your health history. After the extraction, we usually place a gauze to help with the heavy bleeding and help that clot form. Use the gauze the way the dentist explained. A little oozing is normal at the beginning, but what we don't want is heavy bleeding that does not slow down. The clot is very important. It protects the socket while the tissue starts to heal. That's why we want to avoid anything that creates suction, irritation, or pressure on the area. The first days are not for running, working out, or being out there in the sun, heat for a long time. Rest as much as you can. Keep your head slightly elevated when you're lying down, and avoid any intense activity or anything that makes your heart race. Try to keep that simple. This is not the moment to test what you can do. Think of it as a quiet, healing day. So, what can be normal after the procedure? Many patients notice some bleeding, swelling, soreness, jaw stiffness, or limited opening. You may also feel tired and that the area may feel tender when you speak, eat, or open your mouth. Swelling often reaches its highest point around the third day. So if you still feel swollen on the second or on the third day, that can be normal. After that, we usually want to see the swelling and pain go down gradually. It does not have to feel perfect from the beginning, but the general direction should be better. You can place ice or a cold compress on the outside of the cheek, if we recommend it for your case. Keep a thin cloth between them. Do not put the ice directly on your skin. If swelling keeps increasing after the third day, or if the pain gets worse after it was improving, message us. Now let us talk about what to avoid. Avoid spicy, sticky, crunchy, and very hot foods. Those can irritate the area, get stuck, or make healing more uncomfortable. Also, avoid drinking with a straw, spitting forcefully, vaping, smoking, and touching the area with your fingers. Try not keep checking the area with your tongue. All of these disturb the clot formation and can cause a painful healing problem, often called dry socket. Also, don't try to clean the area aggressively. I know it can be tempting, especially if you feel food on the area, but rough cleaning can irritate the tissue and slow things down again. What can you eat? Well, for food after wisdom tooth removal, keep it soft, cool or room temperature, and easy to eat. Good options include soft pastas, mashed foods, eggs, foods that are not hot, smoothies, not with a straw, and other options that your dentist can suggest for your case. Take slow bites and chew slowly. If you can, chew away from the extraction area. Also, drink water and stay hydrated. Avoid aggressive brushing on the area and brush your other teeth softly. Remember, gentle is the word. Do not use strong swishing in the first stage of healing. If you're told to rinse, move the liquid gently and let it fall out of your mouth instead of spitting forcefully. If we gave you a specific cleaning tool or instruction, use it on the way it was explained. Not every patient needs the same routine. We normally place stitches and we will usually see you after 6 days to check on the area and remove them. Some stitches are restorable, which means they can dissolve on their own. Even then, we often prefer to remove them because they can take longer to fully reabsorb. We will let you know on the follow-up visit what's the best for you. Now let's talk about on when to contact us and when you need to see us. Message hisonrisa if bleeding does not slow down, pain suddenly becomes worse, swelling keeps increasing after the third day, or you notice fever, pus, a bad taste that does not go away, difficulty breathing or swallowing, or anything that feels unusual for you. Also contact us if you feel intense pain a few days after the extraction, especially if it seems to move toward the ear or the jaw area. That kind of pain needs dentist guidance. You don't have to diagnose yourself. Just tell us what's happening, and if we need to see you, we will tell you the next step. When to message us? Well, anytime that you feel unsure about your wisdom tooth aftercare, please do. For example, message us if you're not sure what to eat, if the bleeding seems heavier than expected, if pain changes suddenly, if swelling worries you, if you have a question about your stitches, or if you accidentally disturb the area. This is especially very important if you're visiting Mexico City and heading home back soon, or managing aftercare in English while you travel. We can help you understand whether simple guidance is enough or whether you should be seen. We would rather help you with a simple question than have you sit at home wondering if it's wrong. Save this video for the first few days after your wisdom tooth removal. Follow the written instructions from your appointment, keep the area protected, and take healing one step at a time.